Good morning. Always nice to begin the day with you here on 3+U. As you know quite well, school zones are open for business. All the schools are pretty much back in session now. We're getting awfully close to it. So when I found out that our first guests on the show were coming our way talking about National Immunization Month, I, of course, logically, I think, thought that they were talking about kids and immunizations, but that is not the case. Doctors Jermaine and Jermaine Hogstrom with CHI Memorial's Internal Medicine Associates are back on talking to the adults in the room about getting our immunizations as well. So good to see you.
Thank you for having us.
Thank you for having us.
Glad to have you, even though you're talking about shots. I don't care how old you get. That's a true four-letter word, don't you think?
Yeah. I think everybody's terrified at this point.
But you know, something that seems to be kind of a trend, at least with some vaccines, is that it's a one and done.
Right.
Is that right?
Yeah. So some can be one and done, and so kind of case in point when it comes to the newer pneumonia vaccine. There's the Prevnar 20, and so now with the Prevnar 20, you can get that, starting at the age of 65 for average risk, or earlier if you have other comorbidities, and it's essentially one and done. It previously used to be a two-dose series vaccine, but with that being said, for those that have gotten the 2-dose previously in the past for pneumonia, you can still go ahead and get the Prevnar 20. It's a newer recommendation for that extra coverage and boost.
Okay, let's stick with the pneumonia vaccine then for just a minute. Right. If you are a person who is perhaps asthmatic, we see a lot of that in this area. Maybe you have emphysema, something like that. Very important that you get it, and do you have to wait to 65?
Correct. So if you do have any kind of immune compromising conditions or respiratory conditions, it is usually recommended to go ahead and get the vaccine, and you don't have to wait until you are 65.
Okay, you're saying an immune compromising condition. So if you have lupus, that's an autoimmune. That would
be absolutely.
Okay.
HIV. Yep.
Okay.
Anything along those lines, or if you're on any sort of immune suppressant drug as well. So,
okay.
Yep.
When we don't want to talk about COVID because we're all sick of it, but it's still around. And that was one of the scariest parts of it. It was the respiratory concern.
Yeah, it was. Yeah, absolutely. And for the very same reason, that's why we saw generally those that did have some of those high risk factors, whether it was COPD, whether it was some other autoimmune condition, and with a large majority of people that didn't do very well. And so that's why still across the board, whenever with any vaccine, generally speaking, whenever you have higher risk, there's usually going to be some sort of recommendation to get it a little bit earlier.
Okay. I guess we can't talk pneumonia and not talk flu. They kind of go hand in hand. Are we in the flu season? Is it about time to start thinking about getting flu shots?
Yeah, so peak flu season is usually going to be towards the latter half of the fall, getting more into the spring. So I usually recommend patients when they do get their flu vaccines, kind of the optimal time to get it is going to be towards the later fall, those later months.
Okay. Talk to me a little bit about shingles. You can't watch television these days and not see a commercial for the shingles vaccine.
Yes.
Is there only one kind of a shingles vaccine?
So currently the primary vaccine is the Shingrix. There used to be Zostavax, but that kind of phased out. So Shingrix is the more predominant vaccine currently. And so that's going to be more indicated for people that are going to be usually 50 and older. And usually, once again, if you have any immunocompromising conditions, you can get it sooner.
So with shingles, am I right, Jeremy, that you have to be very careful because if you get it, it's kind of you need to act quickly to treat it. Is that right, or else the damage is permanent?
Correct. So if you have any suspicion of shingles, as a general descriptor, it usually starts as sort of like a nerve type of pain. Usually you're going to feel the pain as far as the classic presentation. You'll feel the pain usually before you kind of notice the rash. And that rash can be anywhere when what we call a dermatomal distribution. So if you look up what a dermatome map is of the body, sort of like a sensory nerve map of sort of how your nerves and the sensories are laid out essentially. And so it could usually going to be on one side of the body following that distribution. And so yes, the earlier earlier the better, so we can get you antiviral medication sooner.
So it's going to feel like nerve pain.
Yeah,
usually. But you know, that can also be other things. You can have does that appear in one part of the body typically, the nerve pain?
Usually, right. It'll be sort of isolated. Usually it's not going to be on both sides. Classically, it'll be usually on one side. So whether it's like your left flank, your right flank, it can be on the arm, the face, the back.
Okay.
But you're just going to be on that one side.
But it's not like it's your sciatic nerve or anything.
Correct.
It's
It's usually not going to be like a radiating pain down the entire leg or anything.
Gotcha.
It's going to be sort of like a localized skin pain. Yeah.
Okay, so you come in and you get the shingles vaccine.
Yes.
Is it a one and done or is it a two-parter?
So it is a two-part. Usually they recommend getting it about the first dose, and then the second dose would be about 2 to 6 months after the first dose.
Okay. Also on your list is RSV, and that one surprised me because here y'all are primary care doctors dealing typically with adults. I think of RSV as being something for infants.
Correct. So yeah, it is commonly seen with infants. However, there are cases that we do see with older adults, and it can be pretty severe. Actually, it can put them in the hospital. And luckily enough, the FDA has just approved a new vaccine for RSV, and it's currently approved for ages 65 and older. I believe they are working on a vaccine for younger adults, but that has not been approved yet.
So all the things that we've discussed so far are viruses, right? Which means
Correct.
that they're, I guess, highly contagious.
Yep.
One of the things, I'll go back to our COVID conversation, is that it was such a hard thing when we all lived in isolation.
Yeah.
And it was kind of this balancing act we had to find.
It was.
So if you feel like you're protected with the vaccines, you're then a little bit more Teflon coated to get out and mingle and live your life?
Yeah, I think, and kind of going back to I guess the purpose of vaccines in general is that if you were to come into contact with that virus, it is to help lessen your symptoms, lessen the disease severity, which ultimately allows you to be more confident when going out into the public.
Right.
Something I did not mention before I talk about your dancing talents is tetanus. How often are we supposed to get a tetanus shot? Because nobody wants to get one of those. Right.
So the general rule of thumb for that is going to be every 10 years. And so the people that I usually talk to about it especially are going to be the ones that come in and they start talking to me about that they're doing summer yard work and they're doing, around the barn, around the yard, and again, potentially exposing themselves to tetanus, and tetanus lives in the soil. It's you cut yourself on a rusty nail or something else that's sharp, and you're exposing yourself to these things. But generally, it's going to be about every 10 years. And then if you have any, hopefully not, but any other forms or any signs of tetanus, then that's when you want to get more active treatment for that.
Okay, so they're accepting new patients. If that's not enough, the conversation now to get you in and see how that might be able to help you live a healthier life. They're about to take the stage on October 20th, right?
28th.
Absolutely. 28th.
28th, my bad, for Dare to Dance.
Yes.
Are y'all still in fierce competition? Because last time y'all were kind of combating each other on who's the better dancer.
Yeah, so this year we're doing a trio, so it's a little bit different. I think it might be one of their first trios that we've done. So we have a